morning, viewers. This is TV Africa here in Kampala, Uganda, and I'm called Magundu. Today, we are having Dr. Jotham Musinguzi. He's an MD, Director General for National Population Council. And yesterday we had a meeting. It is more of a conference. It was called National Network of African Parliamentarian Committees of Health to focus on health work issues. So I would like to say good morning.
Good morning to you, Mr. Magundu.
How is life there?
Life is good.
Yeah. This is TV Africa and the program is Foundation Africa. Doctor, what is the PPD? What is the network for African Parliament Committees on health?
Well, Mr. Magundu, the PPD is Partners in Population and Environment, and we working with the African Regional Office based here in Kampala. And PPD is an organization that deals with the advocacy issues on issues of reproductive health, family planning, but also linking the population issues with the development. As you know, the United Nations has agreed on the Millennium Development Goals, which went on up to last year, 2015. And you recall that last year, in September, there was a UN meeting which agreed to extend the MDGs to the SDGs. SDGs are Sustainable Development Goals. So the idea is to link issues of population, issues of reproductive health, issues of family planning with sustainable development. How do we make sure that the development and the way we consume, whether you are talking about utilization of water, utilization of forests, utilization of land, that we can use it now, use energy now in a way that is sustainable, in a way that does not put the future in a trouble. And so those are the type of issues we work with. And the network that we are talking about, the Niapako meeting, which took place here in Munyonyo, is a network for members of parliament of the African countries, both English-speaking, Francophone, and even Lusophone, those who speak Portuguese.
What is the membership of Niapako? How many countries are Niapako?
It is all the countries in Africa.
All the countries in Africa?
Yes, all the 54 countries of Africa. Not all of them were represented yesterday, but as you could see yesterday, we had English-speaking countries, we had Francophone countries, we had even Lusophone countries, and it was a very good mix. It's not always easy to bring all the 54 countries together, but this was a very good a meeting that was very well attended. And these are committees, members of parliament who sit on committees of health in their parliaments, and they came here to share experiences, look at priorities in the new area of SDGs.
If I may ask, when did this program start? What is the difference between PPD? What is the and the Niapako? Is PPD program under Niapako, or Niapako is under PPD?
None is under the other. PPD started like 25 years ago. PPD started after in Cairo, after the ICPD, and therefore it's more than 20 years old. Niapako is newer. It started in 2008.
2008?
Yes, 2008. And it is a group, it is a network, a loose network of parliamentarians who sit on committees of health and who come to discuss priorities in the field of health, especially reproductive health and family planning.
So when you started, what were the missions and goals of Niapako?
Niapako, the aim is in Africa. What should be the priorities of members of parliament when they are discussing reproductive health, family planning, population and environment? What should the priorities be? And as you can tell, you can say each country has different priorities, but actually when you think about it, a lot of countries have similar priorities, and they have the challenges are similar, but the solutions are actually similar. So those who have solutions, they would like to share.
What are those priorities?
Like for now, one of the very good examples is the discussion is what is the proper role of family planning in development, and now when you look at sustainable development, what is the role of family planning? And here the role is family planning is a very good tool is a low cost, high impact application.
What methods of family planning are you advising our African citizens? Because there are some methods of family planning that are here to us as because TV Africa is a Pan-African TV,
Right.
and we push for the best of Africans.
Yes.
There are methods of family planning that we caution about our people and the health of our people. So what are those methods of family planning so far are you fronting to our citizens in Africa?
First of all, we are not fronting any particular family planning methods ourselves. That's not the issue. Secondly, we are also like you. We want the best for the African people.
Africans,
and I think our mission is equally the same, if not more, because we also want to make sure that the African people develop. So the idea is bring to the attention of individuals, families, and countries about the advantages of family planning. How can family planning help individuals, communities, nations to prosper? That is the idea. And obviously, I don't want to go too much into each method and advantage. I think that's not the role of what we should be doing. That is to the individual doctors and programs in the country. But the point here is to say family planning is a low-cost intervention, but it has high impact. The example that I'm giving here, if you look at what is happening in Africa, the African population is like a pyramid with very many kids at the bottom, young people. And the young people at the bottom, when they are very young, it means that countries are said to be young, but these young people have, they make dependency very, very high. In other words, the countries you find they have high dependency ratios. These kids need a lot of health care, they need nutrition, they need schools and all that. So they put a lot of pressure on funds, on finances of the country. And what we are really talking about is how can we ease that situation.
Okay, Doctor, because I can see yesterday I was in a conference, and
Right.
I was looking at everything that was taking place.
Right.
And I'm wondering where you get the money to ship all those MPs to Uganda, because Uganda is the headquarters.
Right.
So who funds the program?
The programs are funded, one, by national governments. Countries meet the expenses of their own delegates. Some of it is done through the speaker, the parliaments themselves. Others, ministries of finance themselves in those countries. Others, they get help from the UNFPA offices, United Nations Population Fund, in those countries. And then for us, Uganda, as a secretariat for this program, we fund their conference needs, like here in Munyonyo, the costs that to maintain them here. That is also the cost is really sort of shared between the government.
You know, the reason why I asked about the fund, as Africans and as journalists in Africa, we always critically review things, because we believe when funds come from outside, I don't get shy to talk about it.
Right.
When funds come from outside, I mean like from European countries, from America, they come with strings attached to them.
Right.
You do this, you are moved, you don't act your mind. So I am happy to listen to you that most of the funds are from African governments and a few come from out. So that is, I think, a success and somewhere development. I have a question, because yesterday I saw something very good. You are pushing for African member of parliament come and discuss, you set goals, and the next meeting you should have achieved them. So what program do you have on AIDS? Because we have had many issues with the AIDS, those massive diseases. So what program do you have about AIDS?
Well, as you can tell, and I'm very glad that you have noticed that the work that we do, we talk to members of parliament, give them information so that when they go back to their own countries, they are able to do their job better. We can't do the work of the parliamentarians. The parliamentarians are very unique. They represent the people. They do legislation in their own countries. They do budget appropriation. They also provide oversight in those countries to make sure there is accountability. So the role of parliamentarians is very important. So for us, our point is when it comes to HIV/AIDS, we say your countries have programs. When you go back, ask what are the programs, including those on reproductive health, those on family planning, including that on HIV/AIDS. what are the countries doing in their own countries. As you rightly said, governments put money, donors put money.
Yes.
Do members of parliament in those countries ask what money is available and what is it used for programs like HIV/AIDS? Is there accountability? Are there people getting access to drugs?
Yes.
Are the drugs enough? If they are not enough, why is that so? And they should also play an advocacy role, because to be honest with you, even the money we get from our governments are not, say, the richest. We also know even the donors, when they bring money, it is not enough. So when you have scarce resources, it is important that you should insist on accountability, make sure medicines, money is used for the right thing, and if the programs are not doing very well, ask why is that so? Because that's the role of the parliament. The parliamentarian, his job is not to implement, but is to make sure that things are done right in addition to legislation. Things being done right by whoever, whether it is government, whether it is NGO, the member of parliament. They are voted by people to make sure that there is accountability. So that is what we endear them to do. We give them information about what needs to be done by HIV/AIDS programs, what should be done by reproductive health programs, and then so they can ask the right questions. So ours is to empower them to do the right thing.
Okay, thank you. I'm coming to one of the last questions. Viewers, this is TV Africa here in Kampala, Uganda, and we are now seated in a Munyonyo Resort Hotel. Here with me is Dr. Jotham Musinguzi. He's Director, National Population Council, and he's here with me discussing about Africa and network for parliamentarians committees on African Parliamentary Committees on Health. So, Doctor, I can see National Population Council. You are talking about family planning. Yesterday, I saw something that really I liked. Because when I do put measures with African Union and what you are doing, it shows signals of Africans coming together. So, what is your take on Africa United? What is your take? Because AU has been, I call it, slow in doing its things. If AU was doing things like you are doing them, come here, set goals, and by next year you have achieved something. So, what is your take on it?
Well, you know, you are critical of AU. Yes, that's the right thing to do. But you also know AU is very big. It is AU. It has heads of states, and you know how they work. When you are comparing the work we do with the African Union is very complicated. I mean, and rightly so. For us, ours is simpler because we are concentrating on committees of health. And we are also part of that union, because you can see we are like one of the pillars of the African Union, and so our work is smaller because we are working as a pillar, and our work is vertical. We concentrate on reproductive health, on family planning, and those type of issues, and the population environment, and we try to work with only committees of health of parliaments, and so our work is very clear. We have a very clear mandate, and we know what we want to do. We focus on those things. So, but we are part of the African Union and of wanting to make sure that Africa is moving as one. We are sharing the strength we have, because in a lot of these countries, yesterday we were quoting the case of Malawi. Malawi is not a very powerful country, but it has things shared yesterday. It was one of the shining examples in this field. They are voting more money for these programs we are talking about. They are legislating. They have put a law. They talked about the law within 1 year after committing themselves to making sure they put a law on other marriages. They did it within a year, and they were sharing it with their colleagues, telling you that these parliaments can be effective in the things they identify in each country. And for us, it is facilitate these parliamentarians so once they identify their own problems, countries have sovereignty. They have sovereign right to decide on what they want to do. Ours is tell you the issues are these, take decisions the way you want, and pick up what priorities you want to take up, and make sure that the people who vote you, people who love you, people who have confidence in you, who see you as their champion, you are able to do what you are supposed to do. You are their representative, you legislate for them, you appropriate budget, you provide oversight to government. Have you done so? And that is the whole question. And so,
what are the challenges have you faced?
The challenges we face is the high turnover of members of parliament,
That is a challenge.
Big challenge for us. Because a challenge, why? Because once we have built
Because
capacity...
I think the more the membership and participation is, the more the critical discussion.
Democracy is very expensive. It's very, very expensive. When we have built capacity for some members, then all of a sudden, after 3, 4, 5 years, they go for elections. Some of them are defeated. We have to start all over again. These would have been champions, but now we have, and then they may not be available to us. Of course, they are in their countries and they could be useful at the country level, at the community level. But in terms for us in the parliament, in speaking out, in making legislation, in a way it would have been a bit of a loss in that regard. Not that we have lost them completely, they are there in the community, but in terms of making laws, it is a little bit of a loss. So we have to start all over again and get a new crop of people. And as you have said, you spend a lot of money to build capacity for them. So that is a challenge for us. So that is actually one of the major challenges. The other challenge is that members of parliament are extremely busy people. So to get them here, and they travel all the way and stay here for 2-3 days, and some of them you can see they were saying, no, I must go back, they have to leave prematurely, others cannot come on the first day. So those are the challenges that we have, but by and large I think Africa is on the move.
It is on the move.
No doubt about
it. It is on the move.
Yes.
Yesterday, Ugandan committee, I saw them talking about health insurance.
Right.
So what do you have to talk about health insurance in Uganda? People who are listening to TV Africa, they want to know about that health insurance, because Ugandan committee set a goal yesterday, so that in the next meeting, the parliament has passed either a health insurance. So I think that would be very good to Ugandans. I don't know, what is that health insurance you talked about yesterday? Because I see you are Ugandan and you must be knowing more about it.
So the national health insurance, the government of Uganda at the cabinet level has decided that they want to have health insurance to make sure that more people are covered by health. Is expensive, and the research has shown that a lot of people, including poor people, spend quite a lot of money of their scarce money on health, medical bills. So the idea, like some other countries, like Ghana has health insurance for its people. So the idea was the Ugandans are also learning from their colleagues from other countries, like Ghana, to say we can put in place health insurance so that people, especially poor people, don't have, when they have issues of medical, they can access health care without being, some of them.
Doctor, I have a problem. In Uganda, you are talking about health insurance, and you are saying it is for everyone, the whole community. There are 40 million, I think.
We are about 38 now.
38, yeah. Yes. So 38 million Ugandans. We look at the structures of our hospitals. Look at the service delivery in hospitals. Government has enough for our people in the hospitals, but service delivery down to the hospitals has become a problem. We see doctors taking medicine to their private clinics. We see doctors not treating patients as they should be doing. Government on top does its work, but service delivery down fails. So how are you going to assure Ugandans that this health insurance is going to benefit them? Because it might be the same down. So,
but precisely those are the reasons why the members of parliament in Uganda are saying we want to make sure there is a health insurance, and they are also aware, and we are telling them, when you put it in place, how are you going to ensure that the health services are available? These doctors who are absent, why should doctors be allowed to continue to be absent? What is the role of the parliamentarians? What's the role of the community themselves? What is the role of the people at the district level? Why do you allow doctors who are employed by you, who are paid by you, to continue being absent? There should be a way of doing support supervision. It is not just the Minister of Health alone, and I tell you the Minister of Health should do better, but also the district leaders, but also the communities themselves. There should be public outcry, and I think this has come out. You have just said it yourself. Yes. I think the president himself, when he was going through the elections, he saw this on the ground. He saw enough of it, and obviously that I think you can see a lot of this is being translated into the way the cabinet is being formed. I think the president is listening in to what he heard, what he saw on the ground. and trying to make improvements. But we're also saying, you members of parliament, you communities, please help. These services are for your people. The poor people, their voice is through the members of parliament. What are the members of parliament doing in order to respond to people who voted for them? This is the message we are talking about.
That is very great. So, if I ask more about the health insurance, I don't know. Do you have it already there to be passed by Parliament, or you are in the process of making it?
So for us, again, as we have said, we are an organization that gives capacities for parliamentarians to do the right thing. And the parliamentarians, as we have heard, they have said they are going to make it their priority. They are going to engage the executive. They are going to engage themselves among these. They engage the ministries of finance and Ministry of Health to make sure this is done. I'm told it is actually in advanced stages in the case of Uganda, but I think in the new government, I think we are going to probably see some changes. But I can only leave that to members of parliament. That's not something that from me I can.
Yes, I believe as somebody who is responsible and as somebody who has set up programs for Africans, you must have chipped into that health insurance. What is there? What should somebody expect about health insurance?
The health insurance in the case of Uganda, and I can also speak in the case of Ghana.
Yes.
What we know is that the idea is you put a mechanism whereby the people who are better off, they pay a little more, they contribute a little more, so that the poorer ones, even if they contribute less, they also contribute less. But because, after all, we know in terms of insurance, the people who are richer, who are more educated, they are not likely to be less. They contribute more. They are also likely to be less sick. So they don't actually consume a lot of services. The services are mainly consumed by the poorer people who have more health issues, and because of that, you'll find that the richer pay a little more for the poorer, and so that everybody has some access to health care. And to me, I think that is what the aim should continue to be, and this has been the case.
That is very great. If I may ask, where do you see all this in the future?
All this is what we are really talking about, is that we see Africa on the move. We see the Africa we all want. The future of Africans should be to get better health. They should be living longer. In Uganda, we have seen life expectancy peaking from coming from like 42 years to now 63 years. This is a big jump of 20 years also in a relatively short time. And we should be able to even do better. And living longer, life expectancy, which is longer, means that healthcare, nutrition, and other things, education, are making a contribution. And we are all looking forward to Africans that are living longer, healthier lives, and living a more prosperous life.
That is very great. I see the National Population Council. Because are the goals of National Population Council the same to NEAPACO, or it is it has its own measurements and vision and the goals?
The National Population Council is a Ugandan office that concentrates on Uganda issues. We have got our own vision and mission, limited to working with mainly within the context of Uganda. And NEAPACO is a network that looks
at
a
bigger network
for Africa, and it is only mainly for members of parliament. But of course, in the case of Uganda, the National Population Council was established to work for all Ugandans, and it is not just dealing with the members of parliament.
So, if I may ask, National Population Council, what are programs do you have in National Population Council?
Our aim is
to make the same as the other family planning, or
no, not at all. Our job is mainly to make sure that issues that link population and government are well understood. There are capacities around. We can make sure that these programs are well prioritized. They are implemented in both at the national and the district levels in a way that is coordinated, in a way that is going to help Uganda.
Oh, I'm very great. Recently, there is an MP who was talking about that government cannot help the youth youth when it doesn't even know the unemployed youth, when it doesn't even know the number of unemployed youth. So I can see National Population Council would be a very great ally to government and helping you to know about, may you be having the numbers of unemployed and in Uganda,
well,
such a kind of statistics.
The statistics are the law of National Population Council is not to produce statistics. Statistics are produced by law by the Uganda Bureau of Statistics, and the Uganda Bureau of Statistics has these figures, and they share them with everybody. So for somebody to claim that they do not know the unemployment in Uganda is to say they have not worked with the Bureau of Statistics, because Uganda has one of the best bureaus of statistics in Africa, and they have been giving out recently. We received the final results of the census, which gave out a lot of these details, and they are very clear on those who are employed, those who are underemployed, and those type of things. And of course, you know, our figures on employment, they are there, but I think that issue must have been because some people are called employed, but in fact underemployed. And I think that is, yes, it's people in subsistence agriculture. Do you say they are employed or they are not employed? It's people who are working the sort of part-time. You know, they don't have, if you don't have a paycheck every end of the month.
Yes.
Do you say, because a lot of people are in the informal sector.
So what would you call employment?
Employment would mean to me is one, of course, obviously there are ways they classify employment. But what you really want somebody to do is to make sure that they have access to a paycheck at each end of the month. That would be what is very good employment. It is predictable. You can say, I will budget that I can buy airtime every month. It will be so much. I'll spend so much on food. I'll spend so. That is a very easy way of doing things. But we know a lot of our people are in agriculture. Today they receive money. They spend another 3 months without getting. Then they go. So they are employed, all right.
Yes,
but
yes.
sometimes they're very unemployed. But others sometimes really the way they are employed, it's not easy to trace how their incomes, and so those are the type of things that bring with. So there is a lot of informal employment and underemployment in Uganda, but that doesn't mean that things are not wrong.
Okay, thank you very much. Here with me is Dr. Jotham Musinguzi. He's a Director, National Population Council. And Doctor, as we are ending, I want to ask a question to Doctor. Usually, TV Africa is a Pan-African television. We always ask the mind of whoever we host about Pan-Africanism and the history of Pan-Africanism and where it is also heading us to in the future. Doctor, you have heard about Pan-Africanism. You have heard about the values of Pan-Africanism and its mission. What is your own say about Pan-Africanism? Is it still alive in Africa, or it has gone with the days of Nkrumah and the Nyereres
You know, fortunately, some of us have also been around for a little while, and so that question is important. I think the role of Pan-Africanism is extremely important. It is true that the Nkrumahs and the Nyereres of those days are not there now, but I think they set a very good background. They laid a very good foundation for the other leaders to move on and make sure that Pan-African doesn't die. It is very, very important that we continue this spirit of Pan-Africanism. It is part of this, the work that we bring with this network of parliamentarians in all of Africa is part of that. For us, we play the role from the technical point of view, but the political leaders must continue to give hope to the people of Africa. This is a continent that has a lot of natural resources, more than a lot of other continents. Africa is probably the most naturally gifted continent of all, but it is true we have not exploited our resources to maximally to benefit our people as much as they should. But I know that with the new technologies, with the new thinking, I think the spirit of Pan-Africanism.
What do you think could have failed? Because 1952 we see countries started getting independence. Then after that, we realized coups, wars, and it kind of like diverted. We are no longer having that kind of good spirit. The Kwame Nkrumah images. The last one, although it was a pan-Arabism, was with Gaddafi. He was cleared. So what could have brought the problem and not focusing more on Pan-Africanism and pushing the theme?
But Africa is not the only continent that has been involved in wars. You know, wars is something that has happened. Wars, they tell you a story because there is always conflict. There is always conflict between countries, between individuals, and so we cannot. The question of wars should not. Europe had wars, America had wars, China was.
I was talking about wars, trying to show you that we had finished struggling for independence.
No.
Then again we see
independence was just
each other, getting funds and being enemies of our own setup. So the whole theme will just die.
No, it didn't die. You see, these are processes. Independence is just an event in the process of something. It is like you being born. That doesn't mean that you have gotten rid of diseases. You have to get education. So Africa has gone through these pangs of birth and of development like anybody else, and I think we are coming out of them. You don't hear coups like you used to hear them earlier on. I think we have gone through that stage. People are now talking about development, and we are learning from history. We are learning from each other. For some countries, but there are not many countries which are now under military rule in Africa. Yeah, not like it used to be. Even now, for you to do a military coup, it can be done, but they are becoming rare and rare. And the countries are moving. I'm sure you know. We talked about people living longer now, healthier lives. We are talking about national insurance and those type of things. There are good things happening along the line. Countries have visions. Whether Tanzania, Uganda, Rwanda, whoever, everybody is talking about revision. There is a development going on, but it is slow. People have to learn, countries have to learn from each other, and the continent is learning. I think we are on the move.
Okay, Doctor, thank you. I see your time bad, but I still have some minutes according to your schedule.
Right.
So, yesterday, I saw a problem in South Sudan. By their presentation, and the mood, it could give you a picture of what is taking place in South Sudan. What has the network, for example, network for African Parliamentary Committees on Health, and I know PPDs under Uganda, but you should also be looking about the neighbors. We are in the East African community relation.
Right.
So, what should we do for South Sudan? Because it seems everything is not going well.
Exactly what we did yesterday by inviting them here. We are inviting.
Is it their first time to have?
No, this is not the first time. In fact, we have PPD based here in Uganda. We have had a particular soft spot for South Sudan because we know they are our neighbors, but it's a young nation, the youngest nation in the world now, and they deserve to be treated that way. We know they are going through challenges like anybody else would do. So for us, we are not surprised about what's happening there, and we know they will go through this at some point. They will obviously overcome these problems. But that is precisely why we want to hold their hand. And bring them together, let them see what is happening in other African countries. We know they have these challenges, but when they stabilize us, they must, along the line, what do they need to do so that they know what other countries have done. Obviously, we don't expect them to be on the same level. As you could see from their presentation, they are still having many challenges, but not surprising. It's not surprising. So we know they will overcome this as time goes on. Yeah.
Okay, thank you very much. This has been Foundation Africa, and this is TV Africa. We are live in Munyonyo, and with me it was Dr. Jotham Musinguzi. He's an MD, Masters in Public Health.
Right.
Then he's a Director for National Population Council. And what was your role in NEAPACO?
My role in NEAPACO was to make sure that we facilitate the process of we bring evidence to
so
them.
He's a facilitator.
Yes, I was just a mere facilitator to be able to make sure that they have the information and the knowledge and the data that helps them to be able to do their job.
Okay, thank you. Your host has been Magundu, and I wish you a safe journey.
Thank you very much. Thank you. It's been a great pleasure to.
Thank you very much. Okay, bye-bye.
Welcome, viewers. This is Foundation of Africa, and today with us we have Honorable Member of Parliament from Uganda. Please talk to the viewers.
Thank you very much. My name is Sylvia Namabiki Sinabudia. I'm from Uganda. Welcome.
Thanks a lot, Honorable Sylvia. Today we're here talking about a very sensitive issue, the Millennium Development Goals, and most specifically we're talking about the maternal issue of maternal mortality and child health and family planning. You're a lady and you're definitely passionate about these issues. But we want to know, Uganda has been doing a lot in reproductive health and maternal health. As an MP, you're a new MP in Parliament?
Actually, I've been in Parliament for 15 years. I'm now out of Parliament.
Yeah, so what are some of the things that as parliamentarians that you've done to push this agenda of the Millennium Development Goals?
Thank you very much. The Parliament of Uganda has been very active in pursuit of the attainment of the Millennium Development Goals. All the MDGs, but personally, I've been very proactive around Millennium Development Goal number 5 and number 4. Number 4 was about bringing down infant mortality, and number 5 was about bringing down maternal mortality. We had a forum, and quite a number of fora, where members of Parliament came together to network, to get evidence, and to do advocacy around these MDGs. One thing which came out, we realized that if we leave government alone, that's the executive to work on these MDGs without any push from Parliament, we thought things would not move as fast as we wanted. In 2001, when I joined Parliament for the first time, our maternal mortality rate was nearly 600 deaths per 100,000 lives, and it was one of the worst maternal mortality rates in Africa and the world. In 2004, we realized that as Parliament we have to come on board. We formed a network, first of women members of Parliament. We brought the evidence on the table, and we started engaging government using the international declarations and agreements, and as well as the regional declarations like the Abidjan Declaration, the Maputo Plan of Action, the Plan of Action which came out of the 1994 World Population Conference in Cairo. So we said, look, government has been committed itself in all these declarations and these conferences and these plans of action to do something to bring down maternal mortality. But the maternal mortality is not coming down. So as members of Parliament now, we want to add our voice and our effort. So I did move a motion for a resolution of Parliament, and we set up quite a number of resolutions. We said government must prioritize maternal health, government must ensure that all these gaps that bring about maternal mortality, like hemorrhage, like sepsis, and abortions, there must be some solutions, specific solutions, like putting up blood banks to ensure that there's blood people in the country, like putting more midwives, ensure that they're skilled birth. So we have a particular number of things that must be done by government. And over the years, we have ensured that we push for money to have regional blood banks in the country, to have increase the number of midwives, to money to build hospitals, infrastructure, improve on the remuneration of health workers, and similar increase on the availability of commodities. We have done an aggressive campaign to support family planning.
We've talked about money, and I was part of the team last year when the health budget, the budget was being passed.
Yes.
And we advocated for MPs not to pass the budget until an increment has been added in the health lines. And I think MPs did very well. You did pass the budget and you made sure that money was increased in the national budget. However, we still have a challenge. We're looking at 15% for health, but we're still even below 10. How are you going to make sure that the budget is increased to cater for the health issues that really are pertinent to this?
So what I can say is that in advocacy doesn't stop. You have to continue doing the work. Unfortunately, this is a new parliament, majority of members are new, but it also gives me now another advantage as an experienced former member of parliament to work with members of parliament. That's why you see me as part of this forum that has been here, working with members of parliament to see how we can strategize in the next 5 years, to see how parliament continues to push the agenda. And now we have transited from the MDG to the Sustainable Development Goals. Sustainable Development Goals are broad, all-encompassing, with the motto that no one should be left behind.
Everything has been,
and so it's fine. It's fine because we have realized over the time, when we talk about maternal mortality, it involves men. It involves men. We are talking about responsible male parenting, responsible fatherhood, responsible male involvement. Because many women were dying because the men did not care. Okay, so it's important that now in SDGs, much as the special SDG on health, general well-being of everybody, from conception to birth, infancy, adolescence, motherhood, and old age.
Yeah, but as we're talking about this, there still is an issue. Young girls are still dying. We don't have the health center there have been advocacy for health center tools to be able to deliver, but that hasn't happened. And we even don't have many health centers in the country. What are we going to do about this? Because
advocacy issues will continue emerging because our population is growing. So there will always be issues. But I have a lot of hope and a lot of optimism because even our economy, is also growing. The economy is growing, the population is growing. True, the economy is not growing as fast as the economy is growing. But I believe when we talk about infrastructure, government will continuously improve the infrastructure. And that's why we are there as advocates. Our responsibility. And now I'm taking a better position. As because I'm not in the government, then I don't have all these limitations that are on the government side. So you can talk about it. We will continue as champions, as advocates, to talk about what government must do. For example, we are talking about the opportunity to harness the demographic dividend. This is an opportunity which comes. We have brought about down maternal mortality, infant mortality
maternal mortality is increasing because a number of children are growing up to become youth, and our population structure is changing. So you're having many children, many young people, even those in their 40s are not dying. So this population must be harnessed.
So what's that?
It must be skilled. First of all, government must invest in money in bringing down fertility. Because if you don't bring down fertility, then we will not be able to manage the population. It will grow and grow and grow, but become unproductive. So we must manage fertility. That these young people who are growing up as healthy young people, they must be able to have the number of children that can be able to look at
and sustain,
and the number of children who will not put pressure on the existing resources. And then these young people must be skilled, must be healthy, must be educated, such that at the end, maybe in 20 years time or 15 years time, we have a population which is productive, but which is not burdened by many dependents.
When the demographic dividend was being launched in the country, they were talking about we need quality of human beings, not quantity. Yeah, so I think that is...
we must have the quantity and the quality. Must have enough. We need the people to provide the market.
Yes.
But when you have the number of people who can't purchase, the number of people who are dependent on others,
so what would be the last word you can give to the viewers?
I believe everybody has a responsibility. And I'm glad that the new SDG was saying, leaving no one behind. Everybody has a responsibility to play a part in ensuring that we move the agenda forward. And for Africans, we must all come together, Africans, to ensure that we have a great continent. We are endowed with enormous resources, so we must tap into these resources to see that we move ahead and remain ahead. And for Uganda, yes, we are the proud of Africa. We are greatly endowed. We must work towards ensuring that everybody, no one is left behind, that we become responsible parents, we contribute to the development of our country, we educate our children, we have children who can be able to look after. At the end of the day, we all have a Uganda which we all be proud of.
Thanks a lot, Honorable. This is Foundation Africa, and we are talking about our very own problems in Africa, the Millennium Development Goals, mostly about the maternal mortality and child infant deaths. Thank you so much, Honorable. We're going for a short break, and we will have more members of Parliament from Malawi and Ghana and the different parts of Africa. Thanks a lot.